we want to welcome you and say, firstly, that we acknowledge the owners of all the lands from which we come from, their elders past, present, emerging. We acknowledge the wisdom keepers, the medicine healers, the light keepers who've brought us to this day. We stand on the shoulders of many great people who've led the way, particularly with psychedelic medicines, against much opposition over many years in some places. Yet these are ancient medicines that have been with us and human civilization since the beginning. We want to ask you, if you are a therapist, to put your hand up, or doctor or clinician of any kind. Fantastic. And we acknowledge all of you, the incredible work that you're doing in the world. It means a lot to all of us that you come out every single day, and we've fought very hard in Australia to make sure that psychedelic-assisted therapies can become available to practitioners and patients to heal the immense levels of suffering in this country. So we're thrilled that so many of you who are clinicians support this work, and that you're leading the field as pioneers and shining your light and showing the way forward with these treatments. That's just so important. So a big salute and blessings to you all. We're going to start now with just a few quick slides. Who's new to Mind Medicine Australia? If you could just put your hands up. Who hasn't been in some of our sessions before? Yeah, a few of you, and welcome. Welcome to our community. We have a big and growing community, a movement that has really fought very hard to make sure that these medicines can become available in Australia. And we're very excited that Australia can be in the position which it's in now as the first nation in the world to reschedule psilocybin and MDMA. On behalf of Peter and I, we also thank you all for the support that many of you give us as a charity. We are a charity, and so we can't do this without support of many other people, financially and in-kind support. We'll now show some slides, quick slides, and then I'll introduce the wonderful group of speakers that we have today. So this session is called Treating Mental Illness Through Psychodrama and Ketamine-Assisted Psychotherapy, a Novel Treatment Approach. Next slide, please, Alan. So just a reminder that we are focused on the development and use of evidence-based psychedelic-assisted therapies within regulated healthcare systems, that's in clinical environments. We don't encourage the use of medicines outside of this context or encourage people to break the law. Our presentations are educational. They are recorded. They go on our YouTube platform, and you can watch them and enjoy them and learn more from them. Next slide, please. So this is the mental health epidemic we have in Australia, and this is one of the key reasons why these medicines were rescheduled. 1 in 4 Australians with a mental illness, 1 in 5, actually, Alan, you could remove that one going forward, so 1 in 5 pre-COVID, but 1 in 4 now. 1 in 7 Australians are now on antidepressants. Children as young as 4 on antidepressants. 1 in 4 older Australians are on psychiatric medications. And that comes with a lot of side effects. Next slide, please. So the elephant in the room for the best part of 5 decades has been the lack of innovation in treatments for mental illness. You can see the elephants trying to get the attention of the bureaucrats, but not getting very far. And finally, we're starting to make some noise, and we're starting to see many bureaucrats and politicians who themselves are suffering with something, or their families, that they're starting to really support these treatments and to support new tools in the toolkit for all of you therapists out there. Next slide, please. So in the case of depression, only about 35% maximum of patients go into remission from current existing psychiatric treatments or psychotherapy or combination of both, with high relapse rates. In the case of post-traumatic stress disorder, the remission rates from current treatments are as low as 10%. We also have obviously major hurdles in treating eating disorders and a range of addictions and other conditions as well. So more of the same isn't going to solve the problem. Next slide. So we're a charity focused on alleviating suffering through new treatment innovation with a whole of system approach. Our focus is on bringing psychedelic medicinal therapies, psilocybin, MDMA, ketamine, into the health system in a controlled way. For us, success means that these do become an integral part of the mental health system, one of the frontline treatments that is offered with informed consent on the risks and the benefits of these treatments alongside other treatments. That these treatments continue to achieve high remission rates. And we're seeing remission rates in current trials around the world of around 60 to 80% after just 2 to 3 medicinal treatments with MDMA or psilocybin. Obviously, that is a huge improvement on existing remission rates from current treatments. And of course, our goal as a charity is that these treatments be accessible and affordable to all Australians, no matter where they're located or their financial circumstances. Next slide. So as I mentioned, these medicines can be curative. They often are, and not palliative. They're not just managing conditions. And there's no evidence of addiction nor psychosis caused by these treatments. Of course, it's very important to screen patients and make sure they are suitable patients for these treatments. Both psilocybin and MDMA have been granted breakthrough therapy designation by the FDA in the US, which is only granted to medicines that could be vastly superior to existing treatments to fast-track the approval process. So as many of you would know, MDMA is now in the final stages of becoming an authorized medicine in the US. Final stages of the phase 3 trial have been completed. And we're also talking today about ketamine-assisted psychotherapy. Next slide, please. And Gita's going to be on here in a moment. So our strategy at Mind Medicine Australia is to develop the ecosystem to make sure that people are educated and aware of these treatments. So we educate the general public, clinicians, like many of you on this call, patients and their families. And we have a strong focus on data and science and evidence-based research. We also do part fund a number of trials. We part funding 3 trials in Australia right now. We run a lot of events. This is our global webinar series, and we're thrilled with the caliber of presenters that we've had in this series this year. Our next session is with Gabor Mate on the 5th of December, and we just have a beautiful group of people on our advisory panel, including Bessel and Alicia and Gita, who are on this panel. And we also have a podcast series that is very interesting with lived experience members of our lived experience panel. We're also doing a lot with the media, and we may plan a big live medical summit in Australia in the next 12 months or so. Our certificate in psychedelic assisted therapies is now regarded as one of the leading courses in the world, with a world-leading faculty, which includes Bessel and Alicia, and Gita Vaid, who I think is on this call now, is the international course director of that course, which we've had the most extraordinary feedback for. We also offer shorter courses and events. So watch this space, because next year we might be doing some very interesting courses with Gita, perhaps with Bessel and Alicia and some of the other wonderful teachers on our faculty. We also support research. So we unlock $15 million of funding for research in Australia through the federal government, which was the largest grant ever granted by any federal government to research and development in psychedelic assisted therapies. And as I mentioned, we are also directly funding research, including the world's first psychedelic registry at Australian National University and a healthy patients trial, which has just commenced, and it's for graduates of our CPAT course, and it's an ongoing trial. So if you're on this call and you're thinking of doing the CPAT training, hurry and register so you can also be a part of that trial. The other thing that we work on, obviously, is the rescheduling of medicines, the cost effectiveness of medicines. So one of the key things we've done is made sure that we have medicine supplies of psilocybin and MDMA at very high quality GMP grade, in Australia available for trials and clinical use. We're also partnering with a range of clinics around Australia, and we have a patient support fund, which you're welcome and invited to donate to, which provides subsidies so that all patients can access these treatments, especially before they become part of the health insurance and pharmacy benefits scheme. Next slide, please. So this is the big news of this year for us, certainly, is this world first rescheduling of psilocybin and MDMA. This was an incredible thrill. We are so proud that Australia should be the first country to lead in this way. And we encourage you all to get on board and support this movement wherever you are in the world. We know now as a result of this that people in the US and Canada and the UK are going to their governments and saying, look what Australia did, we have to do this. Next slide, please. So this is the final, second last webinar in our global series today. And then on the 5th of December, our dear friend, Dr. Gabor Mate, will be talking about trauma, illness and healing and toxic culture. And then we start our new series in February with Dr. Wade Davis, another dear friend of ours. And it's very exciting that he will be part of this as well. So I'm going to talk now a little bit about our certificate in psychedelic assisted therapies. So this is an incredible training program that runs for 4 months, mostly online, but then there's a 6-day residential and there's self-learning in the course as well. If you have a look at our website, Ilan, would you be able to put the website for CPAT on the chat, please? You'll be able to see the faculty, which includes the 3 presenters today and many other wonderful participants. So you can see how the course works online, and you can see some of the wonderful testimonials on there. And this is open for psychiatrists, any kind of medical practitioner, GPs and specialists, palliative care doctors, drug addiction specialists and others, psychologists, registered. Whoever's got their camera on, Ilan, could you put that on audio? Mute, thank you. Registered psychotherapists, counsellors, nurses, social workers, occupational therapists, other allied health professionals, and complementary medicine practitioners. Next slide, thank you. Oh, so here is some of the faculty. You'll see Gita there. You can see Bessel is there. Leisha should be on that photo. And we just had Ben Sessa in Australia for the last 7 weeks. I think it was about 7 weeks. It was a long time, and he just did some incredible work with us, as did Dr. Lauren McDonald, who also came to Australia to teach the intensives of our CPAT course. Next slide, thank you. Oh, no, I should say, just go back to that slide for one more moment. I just wanted to mention that the applications for the intakes for 2024 are closing on December the 31st, and they're filling fast. And the fees for the course are going up significantly on January the 1st, 2024. So we really encourage you to get in now and get the 2023 rates. It's an expensive course to run. And so we want to make sure that you all have a chance to participate. If for some reason you're financially constrained, for example, if you're a nurse or another kind of professional and working in a very high needs area with Indigenous people, difficult communities, you can apply for financial assistance. And we will do our best to support you, because we want to make this training accessible to Australian therapists all over the country. And we want to make sure that there are people trained in this field all over Australia, so people don't have to go to capital cities to get this treatment. Next slide, please. So how can you help us? Well, apply for the training, of course. Volunteer, you can join chapters as well. And if you're based in Melbourne, we do have volunteers that come into our office weekly and support us. We have an incredible Learn section on our website with videos, books, articles, journal articles. Start conversations, fundraise and donate. You know, name us as your charity of choice. think of a fundraiser for us, donate. We have regular donations available or monthly ones, or you can make a big donation, a small one, whatever you can afford. But just remember, we can't take our money with us, so we might as well give with warm hands and help those people who are suffering in this world. Talk to your GP and other therapists about these important treatments. Every time I go to my doctor or somewhere, anywhere, I say, have you heard about psychedelic-assisted therapies? And it's amazing how many have not. And then I give them the link to our website, and then they start joining our educational events and signing up for our trainings and so on. So it's just like a really good virus. You can spread it, and we encourage you to. And attend our events. Next slide, thank you. Donations support financial assistance, scholarships towards practitioner development, these awareness and knowledge building events, research, and other areas that we are supporting. All donations are fully tax deductible. Next slide. And we have some beautiful merchandise, some beautiful gift cards, mushroom cards. We have a wonderful book of Australian stories of healing through psychedelic-assisted therapies with 32 Australians featured. Next slide. And wonderful T-shirts. I'm wearing one today. There we go. That's it. All right, excellent. So now I'm going to introduce you lovely people. Is Gita there? Scotty, could you ring her, please?
She's online. She's here.
Oh, she's there. She's there. Hey, Gita. Can we spotlight Gita? That would be awesome. And spotlight everyone, please. Hi, Gita.
Hello, welcome. Happy to be here.
Thank you so much for all that you are contributing to the training and everything. And I'm very much, and can we spot there? Perfect. The four of you. We've just had the most extraordinary feedback for the course. Gita is the international course director, and Gita, you must feel so proud of this training that we have all created together.
Yeah, it's been a pleasure to be part of it. I'm really excited to hear the positive reviews.
Yeah, it's so exciting. Is there some, I think there's quite a few CPAT students on this chat as well, so on this call. So if you are there, say hello. You'll have the opportunity to put questions into the chat through this conversation. So what's going to happen is Gita's going to moderate a conversation, I believe, with Bessel and Leisha on psychodrama and ketamine-assisted therapy and any other topics relating to self-regulation, Gita. And then we'll have time for some Q&A. So we'll try and have the conversation about 25 to 30 minutes and then time for plenty of questions. Does that sound good to you?
Sounds great.
All right. So, ladies and gentlemen, without further ado, Dr. Gita Vaid, psychiatrist from New York, the International Course Director of Mind Medicine Australia Certificate in Psychedelic-Assisted Therapies, involved with numerous other wonderful luminaries around the world, including Deepak Chopra. Gita, I'm sure you can say more about your incredible work as well. And do you want to just give a little one sentence? Actually, that would be lovely. And what brings you here? What are you passionate about today?
Well, I'm really passionate to share what I've done with my dear friends, who I'm really happy to see, and colleagues, esteemed colleague, Dr. Bessel van der Kolk and Leisha Sky, that I had the privilege to collaborate with and explore together with. And so really what I'm hoping we can converse about and perhaps even show a clip of what we did together of some of the findings that we discovered as we tried to see what would happen between putting together ketamine-assisted psychotherapy with psychodrama. But welcome, Dr. van der Kolk and Leisha Sky. It's really a pleasure to have both of you here and to be doing this with you and sharing.
It's lovely to see you, Gita. Lovely to be here. Hello, everyone.
And Bessel.
Bessel, you're muted. Oh,
Am I? No,
No, you're not
now.
I can hear you.
Yeah.
Hi. Good to see you all.
Good to see you. And Bessel has just finished a paper with the MAPS final phase trials with MDMA, which is an incredible self-study on how MDMA changes one's perception of self, which is going to be published in +1 very soon. And I don't know if you want to mention anything further about this, Bessel, but we would love to share the paper when it's published with everyone.
As soon as it's available, I'll be happy to send it to you.
Yes.
You know, luckily, I was put in charge of the secondary data for the big MAPS study. The study that cost 64 million American dollars. Like, unbelievable.
Wow.
And the study was done to help you in Australia to legitimize your treatments. And you still put it in sort of DSM terms, we're treating that disorder or that disorder. And of course, all of us who study psychedelics know that psychedelics, the God who created psychedelics never heard of DSM.
I love that
It's a
comment.
mostly incompatible way of looking at what psychedelics can do for people. So we live in this pseudo-scientific world of the DSM, which has actually no scientific validity. And then we live in this world of expanding people's consciousness and getting in touch with themselves and developing new self-experiences, which is really quite a different kettle of fish, basically. And so you in Australia, like we in the US, are still beholden to a medical model, but the data that we collected as so-called secondary data, which I think are really the primary data, is how do people change? And how do people's minds change? And Marco Polo's book had an appropriate title, How to Change Your Mind, not how to decrease your DSM score. You know? And so the real pleasure and excitement of studying psychedelics is to really see that people really have access to new dimensions of themselves and new perspectives of who they are in the context and environment they live in. And that happens to also be measurable as depression scores. But what's really fascinating for anybody who is interested in the mind and who we are as human beings, what psychedelics can actually reveal to us and show to us and guide us into is really way more profound than any psychiatric little textbook.
Incredible. Well, congratulations on this incredible work.
Well, it's I'm still a mainstream researcher, so I still use mainstream instruments, and we don't talk about God or spirituality or mystical experiences, as Roland Griffith had the courage to do, actually, who was also in the middle of real life academia. But I think these agents are going to give us a chance to really think much more deeply who we are as human beings.
Mm-hmm. Yeah, well, that is probably the most important thing we can do right now in this very divided world. And I always say to everyone in these sorts of calls and sessions, especially if you're a therapist, you're a lighthouse, and you can bring your light into this world and help transmute the darkness and the trauma. And that's what all three of you have been doing for your whole careers. And we're so lucky to hear from you. Pardon?
It's intriguing, actually, that the early psychedelic studies were largely run by the CIA, the American spy organization. And they studied drugs to see if you could spread LSD or substances like that to warring armies to help them stop. And that's been much vilified. But what's going on right now in the world, I think that wouldn't have been such a bad idea to get psychedelic agents to warring people and have them so like, oh my God, why am I shooting those people? What am I doing here? What is my purpose in life here? And then, ironically, I wonder why the CIA ever stopped using the potential of psychedelic agents to actually bring peace to the world, which is
Maybe that.
Yeah.
And today we're going to share about one of our favorite ways of working with people in groups, which is psychodrama. And Bessel and I have been doing psychodrama for years and years before we became part of the psychedelic world. Do you want to talk a little bit about it from that perspective first before we show the clip of the film? Or
think that's a good idea. It might be
Bessel?
good because we don't have that much time to perhaps talk first about psychodrama as a modality, and perhaps we'll go straight into the example, I think.
Yeah.
Some of you may have heard me speak because I tend to come to Australia every year and show some movies. And my most satisfying clinical work actually is in psychodrama, which is a very interesting dimension. In psychodrama, you play something out in 3 dimensions. And for me, that continues to be really intriguing. And that is that as long as you talk, you sort of have this left brain logical organization. What our early neuroimaging work in trauma showed is that trauma is mainly located in, the impact of trauma is mainly in the right hemisphere. The right hemisphere doesn't know about sequences, and the right hemisphere is purely an emotional brain. But the right hemisphere also is in charge of spatial relationships. And what we see is that if we play our people's life in space, like if I say to you, so would you like to choose somebody here to play the role of your father? And you choose somebody, you probably have a very clear sense of where your father should be. And the moment
In relation to you.
relationship to you. So the moment you bring an imaginary person who plays the role of your dad or your mom or your little brother or something in the room, the feelings towards that person start coming up. It's really, every time I do it, which is quite often, I'm always astounded by how quickly people change their reality and treat that person in 3 dimensions as their parent or as the person they have called in. And I've never met anybody who says, oh, this is not real, I can't do this. Somehow people very easily go into these spatial relationships, and you can create a tableau of what your childhood or wherever was like with all the very relevant people, and you can actually experience the feelings you had then. So you sort of recreate the past in a way, emotionally and physically. And then we encourage people to choose somebody to play the role of the person who you wish had been there for you at that time. And so you may choose somebody to play your mom who, when you were 3 years old, would have held you instead of becoming an alcoholic or running away from home. And then people arrange that person in a way that they feel like, oh, that's what it feels like to have a mom who's there for you at age 3. So you actually imprint a sensory experience that is rather timeless of what it would have felt. This is something I think we as therapists always are looking for the corrective emotional experience. And we hope in vain that by being nice and sympathetic and attuned to people, that we will give them the feeling of what it would have felt like if people growing up would have loved them or taken care of them or wouldn't have done awful things to them. But as my teacher of this method used to tell me, it's the wrong person at the wrong time at the wrong place. I, as an old guy, cannot give you, as a 42-year-old woman, the feeling of what it would have felt like if your mama would love you at age 3. And there is something about the psychodrama that can imprint the sense of, oh, that's what it feels like. So you give people experiences that are lacking, that are missing. So we're talking here really about attachment trauma, developmental trauma, much more. This is actually a dimension that all of us as psychotherapists are very preoccupied with. How do we deal? And the other thing that is so interesting here is that Gita may also talk about it, is that there seem some suggestions that psychedelics open up critical windows of development. And that's the work of Dr. Gül at Hopkins. Incredibly important, because the brain develops by stages, and if at the right time you don't get the right input, your brain does not develop the capacity that it was supposed to develop at this point. And you see this when you adopt orphans from the orphanage who have not been touched and loved let's say the first 2 years of their lives, it's almost impossible for many of them to create a loving relationship with their foster parents because they missed the critical time for brain development to feel safe and close with other people. And in my work, I've come across many people who just simply lacked that early experience and who cannot imprint it on themselves anymore. That's a very big issue. And it looks like, and this is going to be one of the many fascinating things about starting to do psychedelic therapies, that during psychedelic therapy, the mind opens up to new experiences in a much deeper way than ordinarily, and you can open up these old critical windows of development that have become closed. Okay, that's my introduction. Yeah.
Do you want to say more? Or Gita, should we just show the film and then take questions afterwards?
Yeah, the only thing I'll add is I think it might be good to show the film so you can get a sense of what that's like. And the film we're going to show you is a clip that took place in a workshop where tiny doses of ketamine were administered to the individual who is participating in the psychodrama. And we'll talk a little bit about what the impact was of that, and what perhaps the experts in psychodrama, Bessel and Lisha, observed from that. So I'm just going to try and pull up the screen so we can...
While you're pulling it up, can I just say something? Bessel, can I say something? Thanks. Yeah, that we front load our psychodrama workshops with a lot of expanded awareness of our bodies, awareness of our voices. We go through learning a vocabulary of safe touch. There is contact, and it's among a group of people who, when they first encounter each other, don't know each other. And so we work very hard to co-create a self-container for very deep experiences that impact the whole group, whether they're in the protagonist position, directly processing their own material. But usually the material is very resonant for everybody else who's in the circle. And we play roles that also embody some of the people who were real in our own lives. And it's almost like a group trance that we enter together to reenact and revisit momentous scenes, impactful scenes in our lives that become maps of how we react to the world around us.
And the reason why we did this is because Gita heard about us doing psychodrama and saw some of it, and she was aware of the incredible sensitivity of people on psychedelics, ketamine in this case, to take in new experiences in a much deeper way than they ordinarily are. And I think what we're about to show you is an illustration that whatever experience you have while on these psychedelics may have lasting effects. And that's why it is so critical for us as therapists, all of us, you and me and everybody else, to create optimal environments during the psychedelic experience, because the mind is so wide open during that point to take in new experiences. That's why we're very worried about people mechanizing psychedelic treatments, because the setting and what comes into you is going to be a critical element of the whole treatment. Take it away.
Okay.
Hi, Linda. What's on your mind today?
That piece that we did earlier with Ronan, where it's the reach, it was just, it's still latent, like it's still sitting with me, just the grief that came up around the ability to reach towards a man, that the inability to reach for my father has had an impact for me in my life.
So we can start putting him in the room. Is that right?
Yeah,
Okay, let's
yeah.
get you somebody to be the father you could not reach out for.
Alex, could I ask you to be my father that I couldn't reach for?
And role as your father when you couldn't reach out.
Can we try you here, just out of arm's reach?
Absolutely. Try it out. Try it out. Yeah.
And then get comfortable. We'll be here a while.
The witness can see how much you want to take care of your dad. You know, the best. This is okay.
Yeah, that's, and then, oh,
And the geographical position is always astounding. I want him there.
Gita, for some reason, the sound isn't working on the video anymore.
Oh, that's not good.
let's try it on.
I can see that.
I'm not really here.
And it feels so right to hear you say that, because hearing you say that means that you are here. So growing up in Australia, life was hard. We were refugees and then we became immigrants, and my parents worked a lot.
Yeah.
And so I knew that my dad loved us because he was really proud.
Yeah.
It's just this feeling.
It would be a great thing to say, all I knew was how to provide for my family.
All I knew was how to provide for my family.
Can I have my real dad have a support person?
I was wondering about that. What sort of support person shall we give your dad? What do you think he needed? What would help him? Aside from the love that's in his daughter.
He needed elders. So when we left Vietnam,
Yeah.
we left the grandparents behind.
Uh-huh.
And so my dad and my mother, they raised us without
Yeah.
guidance and without elders.
Yeah.
I think that would have made a difference to me.
So can you think of somebody who could play the role of an ideal elder who would be there for your dad?
Teresa, could I ask you to be my real dad's ideal support person?
And with your hands on the shoulder. Is that okay? Yeah.
I enroll as your dad's support person.
You used the word elders. Then you want to use the word elders.
I enroll as your father's elder support person. Can I ask you to just say more words?
What?
Can I ask the ideal elder to say more words?
Yeah, so absolutely.
I would have helped your dad to grieve the loss of our country. I have helped your dad to grieve the loss of our country. And then you meeting me would not have been burdened with being the bridge of hope. And you would not have been burdened with being the bridge of hope. And then you wouldn't have felt the need to take care of your parents. And then you wouldn't have felt the need to take care of your parents.
Yeah.
Clearly, I need a support person to do with my hands.
I think so too. Right. Would you like to, what's the ideal person would you like to choose? Or just a support person, generic, or
I think it's a generic support person. I think this is the missing experience. It's not the ideal father or mother.
yeah.
Yeah, and because I can hear what my ideal elder is saying is landing, but I think having a support person would help those words to land better. Could I have Mariah on one side and Ronan on the other, and one could be this hand and one could be this hand? and then they can each have a hand on my somewhere, which
It's your show.
we'll figure out.
It's your chance.
I know. I think that's what I want. That's what I want.
I enroll as your ideal female contact person.
I enroll as your ideal contact person.
I enroll as your ideal male contact person.
I know it's your ideal man.
Now he's going to arrange you. Don't be spontaneous. He's going to do it for you. But it needs to come from Linda.
Okay, so this hand is gonna be here like this, and then this hand is gonna go back together. Would I ask Paulette if it's okay with you to be my real mother, who's also buried there? I know as your real mother who is buried there. It said, "We, can you please sit next to ideal, next to real dad?" But I want a, can I have a barrier between the two of you? Like, yeah. Oh yeah, that's so real. Oh, that's so real. It's my mother.
When you're traumatized, your mind and brain sort of live in the past. You're still living back there. And so you're always trying to fend off danger. You're afraid of what will happen to you. And it's very hard for you to just be in the present. Because the fear systems keep coming in and say, who's going to mess with me? Who's going to put me down? Who's going to shoot me? Who's going to make me? And so, but as long as you're afraid, you cannot focus on what's going on right now. And so a very important part of healing from trauma is learning to be in the present and to say, it's okay to be here. It's okay to lie in bed with you and to feel your body next to you. Wow, I feel safe now. Huh? But when you're traumatized, that moving body goes, oh my God, something terrible is going to happen to me. And so the challenge is to go like, oh, I feel your body, and I'm here. I do not in the past. You continuously misinterpret what happens to you right now. Yeah? So being in the present is really the core issue.
When you had some of that, I would have punched you in this.
I would have seen you and known you. My heart would have been open to you.
You would have sung to me.
Would have sung for you,
Yes,
and I would have sung for you.
and I would have sung for you.
Say it in a clear voice. I would have sung for you.
I would have sung for you. You would have sung for me.
Maybe you would still sing for it. Will you sing for it?
We would have sung together. That would have been so nice. Ah.
See if you can sing a little bit for her. You do that?
You would have mimed like a like the drag queen. We would have mimed. We have gone to drag shows and lip sync together. This sounds really strange. Can I touch your face? We wrote those. Oh, that was actually enough. Okay, yeah, squish, squish. Oh. I really wish we could have been still together.
Yeah. Like, as your ideal mom, I'm with you.
As your ideal mom, I'm with you. I really wish that we could have touched and played.
And if I'd be your ideal mom, we could have touched and played the word we're doing it right now.
If I had been your ideal mom, we would have played and touched just like we've been doing.
The way we are right now.
The way we are right now. You were just working so much for me that when you were at home, you were just so tired. And I had to be quiet. So that was my way of taking care of the family.
Right? If I'd be your ideal mom, you wouldn't have needed to stay quiet.
If I had been your ideal mom, you wouldn't have had to be quiet. And I would have heard you and Dad screaming at each other with joy.
Right.
And you would have
Well,
heard.
say, you still haven't involved in that your ideal dad. You have to do a
Oh,
little thing like that. You have to do that.
Hey, what did they buy your dad?
Yeah.
Like,
You know, that's your ideal dad.
then I wouldn't have moved through the world trying to enroll every man into me when I do that. When I do that. Ah.
That gives you a ideal dad. You wouldn't know what you're looking for. You know, I'd be ideal dad. You would have known what to look for.
I've been your ideal dad. That's really landing right now. But if you had been my ideal mom, I wouldn't have been in such a rush to get away from you.
Right. I'd be your ideal mom. You wouldn't have to be much in a rush to get away from me.
If I had been your ideal mom, you would not have been in a rush to get away from me.
And witness can see the astonishment on your face as you look at the ideal dad.
Gita, would it be okay to pause for a second? Because I'd love to fill in a little bit about what's happening somatically.
Yeah,
So
just
yeah. Just so what Linda's going through right now, she's experiencing things with these people who are playing the roles of ideal mother and ideal father. First, they came into the psychodrama as support people for her, because so often the emotions that we carry inside that we're least aware of on a day-to-day basis, when they come up in a psychodrama, they come up very powerfully and very vividly, and they can be overwhelming. People can kind of lose it, you know, when they say flip your lid. It can be so much that it's something that puts them into a real fight or flight kind of way, or else into a collapse where it's so much that they just collapse into despair about how deep their pain is. And it's often very agonizing physically, deep emotional pain. They call it heartbreak and gut wrench for a reason. And so we go through, as part of our warming up and training into psychodrama, learning a vocabulary of safe touch. So the way these two people are holding her is a way that she's placing their hands where she wants. She's asked for pressure on the top of her head to help her stay in her body. And that's an unusual request. Not everybody does that kind of thing. But she's got people holding her physically in a way that we've practiced beforehand. She's learned to put her hand on her heart and then bring someone else's hand on top of her hand that's on her heart. We call that a heart sandwich, when they're holding her in the front and the back at the same time. And it helps keep a person present with very intense feelings in a way that's comforting, and helps them to stay present enough to process. And as they're processing, she's thinking, oh, now that I feel this way, if I had felt this way back then, this would have been different in my life. So she begins to free associate about what she could have been like having that support.
Mhm.
You can continue. Yeah, so this is really, it's a big moment, because she's actually taking in something that she might not have thought was possible before. And for some reason, the sound is not working again.
Sound is terrible.
If my parents had an ideal elder, and if I had my very own ideal elder, I wouldn't have been in such a rush to give away my Vietnameseness.
Mm. Mm. Let's take it in. And we're going to start recording. Okay? Are you okay?
Can you pause again for just a quick second, Gita? The other thing to say is that Bessel isn't making any of this up. It's really, he's listening very carefully to the protagonist and her words, and he's doing his best to reflect back accurately what he hears her saying and what he hears her say she needs. And so the sentences that he's offering the people playing roles to say are a reflection directly of what she's saying to him.
Can I just make one other comment,
Sure.
if I might? And that is, I'm seeing a lot of comments in the chat, and I must say I'm having trouble also hearing the video as clearly as what I would like.
Yeah,
And
yeah.
I'm just thinking that maybe what we should do, if it's okay with the three of you, is to pause the video and go more into a Q&A, because I'm hoping that people have got a sense of what's been happening, and there are quite a few questions in the chat. And if it's all right with you, and this is up to you, but a number of people on the chat have asked if they could see a copy of the video so that they can actually watch it and hopefully hear the audio properly. For example, it's hard to hear Bessel's voice when he comes in, and I know what he's saying is incredibly
I'm actually
important.
surprised how bad the sound is, because ordinarily there's something about the Zoom that we're doing.
I think it's
distorts
the
us.
Zoom.
Yeah.
Yeah, it could be.
The
So
Zoom
what I'll
setting.
do, I can send you the actual footage of the whole psychodrama workshop we did, and I'm happy for you to share that with the participants.
Okay, well that would be marvelous. Scott, will you sort that one out with Ilan? Fantastic.
Because the details are terribly important, and if you miss
Oh
all the
yeah.
details, quite meaningless. Yeah.
Yeah. Yeah, we're getting a lot of good feedback about this and getting a copy of the video. So ladies and gentlemen in the audience, if you'd like to put your questions into the chat, there already are some questions here, which I'm just going to go back and
I saw
find.
some that I'd like to jump in and answer.
Yes,
if that
please go ahead, Leisha.
The one for people who don't know what they need, is that what you mean by teaching safe touch? We live in kind of a touch-phobic culture, especially in the psychotherapy world. I come from body work, and I spent decades hands-on before I began doing anything else that was processing trauma or otherwise with people. And so I try and teach the sensitivity of listening to your own body, listening to the possibility of giving or the possibility of receiving. And so we teach about orientation, which is how you're facing, how you're turned toward or away or stand beside someone, and to be able to notice what that feels like in your body and be sensitive to what the person who's next to you or who you're partnered with, and listening to your body at the same time that you're working with someone else, what they might be feeling. And it's a collaborative process of finding what's comfortable, what feels right, and what feels safe with you and this person. And it's different with every single person that we work with. I teach this as a matter of course for anybody who's working with psychedelics. Sensitivity to your body is the way to understand and be attuned to another person's body. And these are all wordless things that happen under the surface of our word states. So the words flavor the top, but everything else is happening in our bodies. It's what attracts us, what we move away from. That's the first level of understanding contact, is proximity and orientation. Am I facing you? How close to you am I? Am I 10 inches away? Am I across the room? That level of distance is something that we sense in our bodies. We sense the calmness in our bodies or the agitation in our bodies at different distances, and what we might be feeling we long for. And maybe sometimes the things that we secretly long for the most are the things that we have learned through our life experiences are the most dangerous for us. And so it's dangerous to even say you want them. Yeah.
In terms of people getting what they want or need. When you're traumatized, you live in a fog of fear and terror and confusion, and you don't really often know what you need or what you want. You just are trying to survive somehow. And what I love about the psychodrama is we just try to recreate the context of where they come from, and then things become clear. Oh, I now realize how angry I was with my father, who was a drunken alcoholic who always put me down. And when you have this virtual person there who plays you that, these feelings come up. And you have no imprint of what it feels like if you have a father who actually loves you and cares for you. There is no imprint of it. The mind doesn't contain that. And now we do it usually without psychedelics. You get a sense of, oh, if my dad would have helped me like this when I was 3 years old, that's exactly what I was looking for. And then people start re-scripting their lives. They say, oh my God, if I'd had a dad like that, I would have stood up for myself in school. I would not have gone to always feel terrible about myself. I would look forward to coming home from school. I would be looking forward to bring friends from home. And so people sort of reconfigure their past on the basis of the current sensory input. And so we do this ordinarily without psychedelics, but I think the reason why Gita was so intrigued with this is while you're on psychedelics, your mind is even much more open, and so you may be much more flexible and capable of taking in experience you've never had. And what is always puzzled me and intrigued me in therapy. If you've never had it, you don't know what it's like. You see other people have it, but you don't really know how to get it. But a very large part of trauma healing is to have the experiences that you needed back then. And that's what we try to do here, is to instill something that you never had. And so when we talk about trauma treatment, we talk about what happened to you and what did happen. But what we don't talk about is what didn't happen and what you needed back then. And as therapists, we try to fill those holes, but in actual fact, we can't.
The thing also, what I was trying to get at is how dangerous we might think some of the things that we didn't get are for us. I mean, with trauma, especially developmental trauma, it seems like love is the most dangerous thing that a person who's been harmed can go towards. And we never say at the beginning of a psychodrama, well, we're going to set you up so that you know what it feels like to be loved. What we do is we help a person recreate one of their internal maps so that we can see what they're actually living with in a way that if we told them, if we said, oh, you need to be loved, it wouldn't go in, it would just be talk. But there's a visceral way of being in three-dimensional space with this person that helps them experience physically and vividly the distances and orientations and relationships that they carry internally. And so they might see that, oh, the person that I always wanted to have love me was a dangerous person. And on a very visceral level, I couldn't. And
for those of you who've done psychedelics, you know, your psychedelic experience is not a verbal experience. In fact, it may be very hard to translate your experience in the psychedelic into words, because words are not big enough to capture the complexity of what you experience. And that's the same thing with growing up. How you find words to explain little segments of what happens, but the real experience is much deeper below the level of words.
I want Gita to come into the conversation because, you know, when we think of psychedelics, it's always we're thinking of somebody going off into the cosmos and seeing the lights and seeing God or something that's transcendent on a very high level. And we're working with very low doses. And I would call this even lower than what you might call a psycholytic dose usually. Gita, can you talk a little bit about nuance? Because this is really an art that we were exploring, the art.
Yeah, as Bessel already said, and Alicia's alluding to, it's really important to get the tailored dosing. And this methodology, which I hadn't been knowledgeable about until I witnessed it with Bessel and Alicia, it's really like entering into a trance. It does allow people to drop into a non-ordinary state in real time. But the ketamine itself, at these microdoses, really allows the people to almost distill out even more into the emotional experience. So they have more access in the moment to experience, not in a mind-based way where you're accounting the dynamics, more in a full-on, full embodied experiential way, what that's about. And we even had some of the participants take a microdose, actually at their request, and they felt they were better able to serve the role and enter into the experience, not from their own kind of self, but more from a place of participating in a very clean way of playing the roles. And in that group process, everyone was involved to be within the structure, and simultaneously, it really, in a real time, also touched on everyone else's own relationships to the figures in their life, which were corresponding. So even though I was playing the elder who wasn't really available, it also, I was at service, but it also touched on my own ancestry in a very real way. So there's a very collective shared experience. The doses we used in the ketamine were really in the range of 5 to 15 milligrams intramuscularly, so very small doses, because as you can see, the participants are very present, their eyes are open, they're able to engage. So really it was really closer to 5 to 10, but that would be the 15 would for sure be the maximum. In this actual workshop, I think it was less than 10 was the maximum. But it was just enough for people to just drop in and be really present in this experience. And the space between each other also shifts because it's a very amplified field where everyone's sort of in resonance with each other. I don't know how much you can feel that in the video. Hopefully when we send it around and you can actually hear it, you'll get a much better sense of what that experience was like to be in the workshop. We have several other cases you'll also witness if you watch the whole recording.
And Tanya asked us earlier to make a plan for when we come to Australia. And I'm so overwhelmed right now, I didn't make plans yet. But in fact, when I see the work, I think, yeah, we need to really, if you guys are interested, and
we'll do it. You have our word. We'll do it. We'll
we'd be
support you.
very
And
happy to do a workshop
yeah,
like
we'd
that
love to make it work. So
in Byron Bay
I
or
promise
something.
you that. Like there'll be such a huge demand. I think just a show of hands here to our community. If you are interested in attending an event, workshop like this in Australia, we may have this opportunity in March. Just put your hands up. Yes, I can see a lot of hands already.
Yeah.
And this is only a small part of our community. So yeah.
We would love to bring a psychodrama workshop to Australia.
Yes.
You have an experience. This is, I love to intellectualize and explain, but this is really about experiencing deeply what these changes can feel like.
Yeah, I think for me, this kind of experience is almost a prerequisite for doing deeper psychedelic work, getting into your body, understanding what your issues are, bringing them up in a way that you're really, really present with them. And I mean, there are people who've done talk therapy for years, and they still don't know how to be present with their emotional feelings and the physical sensations of intense emotion. And this is a process that can bring you fully there in a way that when you go into a deeper state, and I love the psycholytic state as well as the high state, where you can really, really meet yourself very fully and very intensely. This is excellent preparation for doing that in a way.
You may be able to say something about how we got to integrate your body work into the ketamine trainings that we're doing, because it was quite a moment of enlightenment, actually.
Yeah, Bessel was supposed to talk, and he was delayed in being able to present that evening. And I got to
about dosages.
Oh, about dosages? Yeah. The thing is that I got to lead a somatic awareness session of about 40 minutes, and there were some people in the session earlier in the day who seemed to need very, very high doses in order to register that anything at all was happening. And I've seen people who are really uptight kind of snap themselves out of a journey, mid-journey, if they hear a noise that's funny or something. And this woman came up very frustrated, who'd had one of the highest doses of the session in the training program. And she was crying, and she said, "I don't need a higher dose. I need what you're doing." And
say more about it.
I feel so blessed that the leadership was able to say, "Okay, let's try it." Say more about what we do.
So no. The realization you came to is that some people required extremely high doses before they felt anything.
Yeah.
And you realized that they had, like many traumatized people, had learned to ignore or dissociate their bodily experiences.
Right.
Psychedelics is primarily a somatic experience as you go into. And so you decided, and we decided as a group, how important it was for people to be aware of their bodily life.
Yeah.
And really help to make the psychedelics much more efficient. And I think we all had agreed on that. And from that time on, you have always done an important part of the training. It consists of your helping people to be aware of their bodies, which makes the psychedelic experience much, much deeper.
Yeah. Oh, undoubtedly. And the thing is that, you can be present to the subtleties of the medicine coming on, the edges of things changing before you get to anything big. It's like a way of listening into your own experience, listening into yourself. And you develop the capacity to savor the experience on the way out of the journey as well, that you don't have to snap back to and become this presentable person, but that you can linger and harvest more of the insight from your experiences. You can, it becomes part of the integration process to be able to stay in, even as the medicine is fading away, to really, really, in that state, you're still wide open to begin to reflect and possibly review with a person or persons who've been sitting with you, and harvest and land more of the insight that you could bring back from an experience like that. Yeah.
That's brilliant,
You want to say, Gita?
Leisha.
Yeah, I was going to say, I think it's what Leisha's contribution, and actually you'll see her doing some of that in the psychodrama workshop in the recording. I think it's so powerful because not only were the doses less, but it's so difficult to learn how to navigate a psychedelic experience. And oftentimes people are just blasting to beyond themselves to kind of go to these ego dissolved states. And Leisha really gives these kind of, resources a person to learn how to navigate the experience so they can stay within themselves, have lower doses to have an experience. But I think in some ways it's also, as Bessel is touching on, giving you tools to reclaim the parts of yourself that you have lost while being able to navigate the psychedelic experience through these tools so you can actually reconnect with the body and discover the body, which in some ways might become the most important aspect of the journey itself. So it's a really important aspect, which I think is actually a big element of the healing when that aspect is able to be included as part of the work instead of sort of bypassing the self.
It's so, I just want to comment that it's so powerful when you think about a major medicinal dose, you're actually going out of your body. Here you're really trying to stay in your body. And of course, so many people are finding it very hard to feel what is going on in their bodies nowadays because we're so connected to screens and other devices, and people are generally very disconnected from themselves and others. This work is really fundamental for that reason.
Yeah, absolutely. I find that when we work with people with lower doses, they have so much more immediate access to their emotional sensations. It's almost as if they bloom and become more vivid. And even painful emotions, they somehow have the capacity to stay present with them more. But that only happens within a certain range. It doesn't happen if you're going so far out that you can't remember to bring it back. And the microdoses are one where you actually have access to all your language. And
it's a fascinating modality. There's quite a lot of questions in the chat about the similarities to this process with compared to family constellations or family systems therapies.
We haven't been trained in family constellations, but I think the difference is that here there is no improvisation on the part of anybody except for the protagonist. And so from what I hear about constellation, everybody else's experience becomes relevant. And here we really focus with surgical precision, as if we can, on the protagonist, and everybody's there in the service of giving the protagonist what they need. And it's not sort of a free for all for everybody to free associate to it. So I don't know constellations very well, but I think that's a major difference.
Okay, thank you for that.
So many people ask if it's like constellations, that there must be some elements that are common. I think it's in the Moreno psychodrama world, this would be close to what they call a frozen atom or a family atom, where you see the map of your family life. That's generally part of what we're working on. And then we also
because we really try to create a new experience for people.
Right.
So that's the difference from just having a psychedelic experience where you sometimes see the pain of the past. Actually, you see it very often, and you become aware of it and maybe accepting of it, and become more self-compassionate about realizing what you've gone through, but it may not become a reparative experience. And so what we hope to do with psychodrama is to make use of the window of openness to not only be in touch with the stuff that keeps messing up your life, but also to get a reparative experience that heals it during the experience.
And
I
there's
think, oh, go on, Tanya.
no, I was just going to say there's a question here about the person wonders if other drama therapeutic practices could engage with participants where the psychodrama structures are too confrontational. Have you ever found that this process is too confrontational for any participants in your workshop so far?
No, not really. No.
Yeah.
It's not
Confrontational in what way? I mean,
He says, I've found the specific roles, attributions, allocations are not for everyone. That is, they'd rather use characters from drama and theatre, non-human and inanimate objects as part of dramatic projection.
Yeah. That's another interesting conversation. Doesn't quite, no, we haven't done that, and so we don't know. And
it's not either or.
No,
It's not either or. This is one particular method that's the theatrical method.
Yes.
We have friends who work with Shakespeare and have people say other lines that aren't their own, but that reflect the situation that they're in. But that's another modality. Just presenting this was an art workshop where we really were bringing together two different modalities that we work with and love to see what would be enhanced by bringing them together.
Oh, it's fascinating.
I would say, as someone who's
the window opens.
Go ahead.
And so this is just one way of making use of that open window of the mind to instill something that under ordinary conditions may be difficult to instill. But
yes.
We'd be the last person to say this is the only way to do it, you know.
No, I mean it's an incredible. I mean, pairing the ketamine with the psychodrama, it's really, really interesting and powerful. I imagine it could also be done with small doses of MDMA. Actually, just thinking about this in the longer term, I imagine that will be hopefully something that's possible as well. What do you think about that, Gita?
I think it's really interesting to think how each medicines have unique fields and what would be the advantageous methodology to pair with it. I just want to go back and one comment about this structures workshop with the psychodrama, not being knowledgeable in all the different, but a lot of the advantages I saw in this particular form of psychodrama structures was how much attunement there was. And I do think in general with psychedelic psychotherapy, the attunement, the corrective relationship, the real resonance, the care, and you can see how precise Bessel is in really being so close to the patient story. I felt there was something so respectful about documenting the structure in the mind, as well as trying to listen very carefully to have it be patient directed of what the repair or what the wished for or ideal would be. And there was something about that part which really felt very respectful. And I think this whole being patient directed and really trying to, as much as possible, follow that directive rather than inserting. I think we have to be careful if we're thinking about inserting new possibilities, that the possibilities really come from the subject themselves as accurately as possible.
Yeah. And I'd also say, I saw a comment that psychodrama is like a psychedelic state, and I completely agree with that. For me, especially if we expand our awareness before we go into the psychodrama, it feels like a group trance state. It already feels like there's a deep attunement that brings up emotion, especially for the person who's in the protagonist seat. Every time a new person enrolls as a person in their psychodrama, the energy intensifies and intensifies and intensifies. So their emotions are already blooming. But I think for some people who might be very inhibited and uptight, this is something that helps them to trust and open up just a little bit more. It's not a huge dose. I wouldn't call it. Yeah.
Just to clarify, just one of the questions here. So I think to Steve, the work that's done here with clients, no, they haven't already necessarily had full dose psychedelic assisted therapies,
Yeah.
right? Right.
Right.
Yeah. So their
Well,
clients,
this is
well,
pretty high functioning group, actually, huh?
yeah, yes, it looked like it. Yes.
Although we do psychodrama with a whole variety of people,
Mhm.
and also our ketamine-assisted psychotherapy workshops are relatively open. We don't have that much of a screening process, and what I love about our training program is that people sit for each other,
Yes.
which I think is a beautiful model, because the way we did our MDMA study, 2 therapists for 36 hours, unaffordable.
Yes.
But setting up containers where people can sit for each other with a few experienced facilitators, I think makes the whole enterprise much more affordable for very large numbers of people.
Oh no, absolutely. And I mean, one of the key features of our intensive program, our intensive workshop with our CPAT training, is that the participants are sitting for one another, which is very special for them to do. And I think everyone loves doing that. I can see one of our breathwork facilitators on this call, Maurizio. Hello. And we also are very interested with the Healthy Persons trial that I mentioned before, that there's going to be 6 therapists in the one room having either psilocybin or MDMA assisted therapy together. I'd love to be one of those people in the room. I think it would be really fascinating what might, emerge. So
the possibilities, this clearly is a revolution. The possibility of stuff we can look at is infinite. One thing that really intrigues me is how many people go through the experiences who seem to resolve some somatic problems, like migraines,
yes,
and maybe even autoimmune diseases. We haven't studied it yet. And so nobody should make any claims about it, but there's enough little anecdotes that makes it intriguing to what degree the whole organism, not only the mind, but the whole organism can reconfigure itself with these agents. And so there's so much to discover still.
And that is absolutely fascinating, that.
Could I make one little comment about the medicines? Our structured psychodramas go anywhere from 45 minutes to an hour long generally. And the half-life of ketamine is about the same amount of time. And so even with a microdose, it's nice to have a beginning and an end, and a sense of coming into that open state and knowing that it's going to end. I think if you were using a medicine that was going to last a lot longer, there would be different things to process over time, and it would be a much more lengthy experience. This way, everybody who's having a turn as a protagonist gets a full experience and closure, and doesn't have a tail of medicine lasting a long time afterwards. So I appreciate the efficiency of having ketamine as the medicine we used.
Yes. Yeah, no, that's perfect. And also, of course, it's more accessible than some of the other medicines as well. So
it's legal in the United States, so I'm
and in Australia.
Yeah.
I'm just going to see if there's any other questions, because actually what I'd really love to do, because I know that Gita was stuck in traffic, but I'd love to, even if Bessel, if you have to drop off, I wouldn't mind just having a quick conversation with Alicia and Gita just to discuss some logistics on a couple of things. And maybe what we'll do, Scott, are you there?
Yeah,
I am.
Yes, Scott, if you could, would you mind just sending Gita and Leisha and myself another Zoom link, and maybe if we come out and just come straight back in just for 10 or 15 minutes. Is that okay with you two?
Sure.
Okay, let's do that. And look, meantime though, I just want to just give a huge thank you with so much gratitude from my heart and from all of our team and everyone involved with Mind Medicine Australia. The three of you, we value your support, your friendship, your wisdom. It's extraordinary, and we're looking forward to spending more time with you and creating many more extraordinary opportunities for people to engage with you. And we just want to thank all of you who've been on this webinar. We hope that it's been fruitful for you. We'll get the video, and we'll send a thank you note with some links, and as soon as Bessel's published paper comes out, we'll also share that with you. And we just really encourage you to sign up for CPAT as soon as you can, because places this year we had a massive waiting list and we couldn't accommodate everyone who wanted to do the training. And once you see the feedback that's on the website, you'll want to do it. So sign up now and before the prices go up. And we look forward to meeting you over these coming months, and come join Gabor's webinar next month as well. So thank you all.